Hello everyone and welcome. Today we're diving deep into a parasitic disease that affects millions worldwide, bladder schistosomiasis, also known as urinary schistosomiasis or bilharzia. This often overlooked condition can have devastating consequences if left untreated, so let's learn more about it. Bladder schistosomiasis is caused by infection with parasitic worms called schistosomes. Specifically, Schistosoma hematobium is the primary culprit responsible for this particular form of the disease. These parasites live in certain freshwater snails, which act as intermediate hosts. Humans become infected when they come into contact with water contaminated with these snails carrying the parasite's larval form, called cercaria. Here's how it unfolds. Cercaria penetrate the skin of someone swimming, bathing, or washing in infested water. Once inside, they transform into schistosomuli and migrate through the bloodstream to the liver, where they mature into adult worms. The adult worms then migrate to the blood vessels surrounding the bladder, where the female worms lay their eggs. A portion of these eggs are passed out in the urine, continuing the parasite's life cycle. However, many eggs become trapped within the bladder wall, triggering a chronic inflammatory response. This inflammation leads to granuloma formation, scarring, and ultimately damage to the bladder tissue. Bladder schistosomiasis is prevalent in many tropical and subtropical regions, particularly in Africa, the Middle East, and parts of South America. Areas with poor sanitation, limited access to clean water, and frequent contact with infested freshwater sources are at highest risk. Children are especially vulnerable, as they are more likely to swim and play in these waters. The signs and symptoms of bladder schistosomiasis can vary depending on the severity and duration of the infection. Early symptoms may include a skin rash or itchy skin at the site of cercarial penetration. As the infection progresses, common symptoms include blood in the urine, which may be visible to the naked eye or only detected through a microscope. Painful urination, frequent urination, and abdominal pain are also frequently reported. In chronic cases, complications such as bladder fibrosis, hydronephrosis, swelling of the kidney due to a buildup of urine, and even bladder cancer can develop. Diagnosing bladder schistosomiasis typically involves detecting Schistosoma hematobium eggs in urine samples. Microscopic examination of urine is the most common method. Sometimes multiple urine samples collected at different times may be needed to increase the chances of finding the eggs. Other diagnostic tools include blood tests to detect antibodies against the parasite and imaging studies such as ultrasound or cystoscopy to assess the extent of bladder damage. While there aren't distinct types of bladder schistosomiasis, the disease can be classified based on its severity and the presence of complications. Cases can be categorized as early or late stage, uncomplicated or complicated, depending on the extent of bladder damage and the involvement of other organs. The mainstay of treatment for bladder schistosomiasis is the drug praziquantel. Praziquantel is highly effective in killing the adult worms. It's usually administered as a single or two-dose oral treatment. In addition to praziquantel, management of complications such as bladder fibrosis or hydronephrosis may require additional medical or surgical interventions. Regular monitoring and follow-up are essential to ensure treatment success and prevent recurrence. Preventing bladder schistosomiasis requires a multi-pronged approach. Key strategies include improving sanitation and hygiene practices, providing access to clean water, controlling snail populations in freshwater sources, and educating communities about the risks of exposure. Mass drug administration programs targeting at-risk populations with praziquantel are also crucial in controlling the spread of the disease. With prompt diagnosis and treatment, the prognosis for bladder schistosomiasis is generally good. However, chronic infections can lead to irreversible bladder damage and increase the risk of bladder cancer. Recent research efforts are focused on developing new diagnostic tools, vaccines, and treatment strategies to combat schistosomiasis. Studies are also underway to better understand the long-term effects of the disease and improve the management of complications. Continued research and collaborative efforts are essential to eliminate bladder schistosomiasis as a public health problem. Thank you for watching.